Okay. Rufus, could you please take me through the simulated learning experience in your own words?
Yeah, so from my perspective, I felt like this simulated experience was something to replicate kind of like what a clinical practice situation might look like. And it just gave us an opportunity to go through what a potential scenario could be that we might face as athletic trainers. And essentially, we acted as the clinician, and either patients presented to us or we went to them or we were already with them like in a practice situation. And it was our job to kind of identify like what signs and symptoms they presented with and kind of classify them as how emergent their condition might be, and then providing appropriate care based on what was provided to us in our simulated clinic that we were in.
How did the experience overall make you feel when you were a part of it?
When you kind of getting into it right off the bat, like obviously some of the visual aspects of the environment didn't replicate exactly like what clinical practice is like, but like the just kind of the feeling of being in there and how realistic the patients presented. It kind of just gave you this feeling like you were in like what the job is really like, and a little bit of kind of those, I guess I'll call it like visceral feelings that you might get during clinical practice when you have like an emergent patient case like that. It's like real-time reaction, like you don't have time to just kind of sit back and think like you might during like a traditional lecture or like a lab experience. You just kind of have to act like it's the real-time situation and act on your immediate knowledge that you've learned over the years, either in education or through clinical practice. And then kind of afterwards, like when it's all said and done and you get like the chance to decompress, you're like, oh wow, like this is what it could really be like in clinical practice. These are some things I felt like I did well, and maybe some things I can improve upon. So it just offers like a good opportunity to kind of self-debrief and kind of think through things that went well and what didn't go so well.
Okay. Thank you, Rufus. Have you ever been involved in a simulated learning experience before?
That was my first one.
That was your first one?
Yeah.
So in general, in other continuing education experiences that you've been at before, how did this one compare?
It just really feels a lot more lifelike. So I feel like not a lot of clinicians or like athletic training programs have used this. Like especially like when I was in school, that wasn't really a thing. At least where I went, and so it's like instead of just having like a mock patient or like just someone to practice skills on, it's actually like you're in like the real situation practicing those skills as if it's a patient right in front of you.
Thank you. Your simulated learning experience included lecture, simulation, and debrief. Can you please discuss which part or parts of the session were most beneficial to you?
Honestly, I think the simulation and the debrief, those kind of hit home the most, because that's where you're in the simulation, like applying the hands-on experience that you either should already have or had gotten refreshed on during the lecture. So I think as far as applying to clinical practice, that's the most meaningful in my opinion. I think the debrief was a good opportunity for all the clinicians to come together and kind of talk about how things went, as well as also hearing a little bit from the patient's perspective on how they felt the care was provided to them. I think also having the lecture at the beginning is good because some of that information might be more current than what our education level was when we went through undergrad or through grad school. So it's nice to kind of get that refresher before you get thrown into the situation. And then also seeing if there is any new information, what I might need to go and follow up with after the simulation to better my clinical practice.
So if I can kind of summarize what you said, you at first started with simulation and debrief, but then kind of talked about the lecture part also. So all three were vitally important to you.
Yeah.
Did one play a greater role than another, or?
I think looking back at it, the thing that provides like the most like memorable experience to apply to clinical practice would just be the simulated experience.
Okay.
Like afterwards, it just kind of helps increase your confidence and your knowledge base. If we ever face that kind of situation in clinical practice, we've kind of been through it and as close to a real-time experience as possible to kind of give clinicians a little bit of like a calming effect going into that situation. Like, okay, like maybe this is my first time actually seeing this in practice, but I've seen it in a simulated experience, which is as close to the real thing as you can get without actually being in that situation.
Rufus, did you have any challenges during any part of the experience? And if so, what were they?
As far as like the technicality of the simulation, like I think because it wasn't like an athletic training facility that we were like familiar with, it's when you're in the heat of the moment, like finding supplies could be like a little bit of a difficulty, but that's also like obviously in your own facility you should be very knowledgeable of where your things are at, so like that shouldn't be an issue that would translate to practice. I think one of the big things that kind of was an eye-opener from that is just like the communication between the healthcare team, making sure that remains as high as possible and someone emerging kind of as like the pinpoint or the lead person in the scenario, so everyone knows like, hey, like EMS has been activated, so we don't need to call multiple times. Things like that kind of came up during our group session that we had. Some other things would be just making sure that every patient is accounted for, not letting patients like walk out of the facility if they felt like they weren't being acknowledged as much as they should have been. I think too, for some of us, because maybe we don't stay as up to date on like the newest education that may come out either on a yearly or like biannual basis. There was some frustrations in the group, like that they learn new information right before the simulation, but that also kind of falls back a little bit on the clinician, as they should stay up to date on what the best evidence is. So then just trying to apply something that they just learned a few minutes ago can sometimes be a challenge, but I think that's also like an eye-opening experience that they should then use that to prepare for the real situation when they go back to their clinical practice.
Rufus, what specifically, if anything, did you learn during the entire experience?
I think the biggest thing that I took away from like being in a simulated experience like this is like we can never like practice enough or be prepared enough for these real-world situations with our patients. Obviously, with some of the cases that were presented to us, some of these were potentially life-threatening if they weren't managed appropriately. And so I think it just really shows the importance of clinicians and athletic trainers finding the time and the appropriate methods to practice some of these very important situations on a regular basis, whether it be monthly or quarterly, whatever works best in their practice and with their coworkers. But I think it just really shows, even if this is something you might only see once in your entire career, it's important to practice it more than just one time.
Great. Thank you. We're going to kind of move on to some best practices. So could you please summarize best practices for recognizing and managing exertional heat illnesses?
I think the biggest thing, and this kind of came up in our discussion because of clinicians being in different settings, but obviously taking appropriate core temperature with a rectal thermometry is very important, and some people express barriers with their setting or the patient population that they work with, if they would feasibly do this, or if there's any legality to if they would try to administer this like diagnostic tool or this intervention to help decide what the appropriate course of care is. But I think that's the biggest thing, and then also just knowing the temperatures that we're trying to identify as we're assessing our patients, and then knowing where we go forward with that, how long they should be submerged for, if that is indicated, what your protocol is and should be as far as not allowing EMS to like overcall or override the decision and take them out of immersion early in order to transport them. Obviously, we need to make sure that we reach our cooling temperatures to keep the patient's health and safety at the primary forefront of the scenario. Is there anything else with that you'd like me to touch on?
No, I think you did a really good job with exertional heat stroke specifically. So we talked about a few other topics within our educational session.
Mm-hmm.
I'm going to go just one by one and kind of talk through or have you talk best practice through me with a little bit. The first one's hyponatremia. So what would you how would you summarize the best practice for recognizing and managing hyponatremia?
To recall back onto our lecture that we had.
And if you can't remember exactly what we said, just do the best or do how you would, what you would consider for what you know is best practice for it.
I'm having a brain fart.
That's okay. Do you want me to go to one of the other ones for you? How about rhabdo, exertional rhabdomyolysis?
I think obviously some of the different signs and symptoms that the patient presents with, and also knowing what their training regimen has been leading up to that are some big things to consider. So how intense their activity has been the last couple days. If a patient indicates that their urine color, we always talk about like the classic, like the Coca-Cola colored urine, but if they talk about their urine looking a lot different than it usually has, I think that indicates further discussion. Obviously, if they're already like in an emergent case of rhabdo, you're not going to have time to wait for them to go to the bathroom again and check that. But that's something to ask for, and hopefully they've noted that as they've been using the restroom over the last couple days. But then also the extreme amounts of the fatigue and the soreness and those kind of symptoms that they present to you are very important to recognize.
Thank you, Rufus. And the last one is going to be, can you please summarize the best practice for recognizing and managing specifically sickling?
Sickling. So with this one of the things is knowing like what their conditioning or reintroduction to physical activity has been. So if they're just coming back from a break from activity or from sport, if they're just being thrown in 100% conditioning right off the bat, that's one indication, is that they probably haven't been properly reconditioned to their activity. If they're presenting with the signs of that acute and severe fatigue and just like the general body weakness, and then sometimes you might notice like the things with difficulty breathing. Those are the things that come to mind for me right off the bat.
Thank you. Specifically in your practice, have you had any exertional heat illnesses cases since you attended the GLATA simulation?
I have not in my specific clinical practice. I have had coworkers who have since the GLATA simulation.
Okay. And because you have not had a specific case, though, have your thoughts or practices changed regarding exertional heat illness since the simulated learning experience?
Yes, they have. And I think this is, I'll speak for myself first and then more like generally across athletic training as a whole, but I think the importance of recognizing your environmental concerns, those should never be overlooked when it comes to patients' participation, whether it be indoor or outdoor, considering your environmental hazards that might be at the forefront of that session that they're in. I think communication with not only just the healthcare team, but other stakeholders such as coaches, strength and conditioning coaches, making sure that they're knowledgeable and aware, and then also that they understand that the athletic trainer has the autonomous say if the situation presents as being hazardous to any patients, then the activity is modified appropriately to avoid any sort of heat illness. I think the education is a huge part, and then always making sure for those sports that are kind of going heavy in the fall or in the outdoors, making sure that hydration is monitored appropriately and we're considering our sweat rates and all of that as we should to help give our patients the best outcome possible.
Now, those answers that you just gave, are those, so you talked about what was supposed to occur.
Mm-hmm.
What have you specifically done at your clinical site? Are those all things that you've implemented, or could you kind of talk me through changes that you've made at your exact clinical site?
So I try to do a good job of checking daily how much weights are changing, as far as seeing if we're having decreases of more than 1 to 2% in weight with patient populations, then this would call for modified or cessation of activity for the day in order to allow patients to adequately rehydrate before another training session. I think also the patient education is something that I've touched on, and having them be knowledgeable of the signs and symptoms that they need to report and taking things seriously. And then also stakeholder education is something that I've done as well, talking with coaches and strength and conditioning staff so that they're knowledgeable as well, since they also play a role in the activity that this patient population takes part in, and then also they can play a role too in avoiding some of these catastrophic situations.
Have the changes that you've implemented worked? Have people kind of bought into the idea?
I think so. I think the patients, obviously, when you talk to them about something serious like this and you try to convey it like with a sincere tone of voice, they understand like how much like you value their health and safety, and how much the patient themselves should feel empowered to value their health and safety as well. I think strength and conditioning, they sometimes can see a little bit closer to eye with athletic training than maybe just traditional coaches do, and so getting them to buy in is something that's important, and I think I've seen that as well, that they understand that there's limits to how far student athletes can be pushed before some of these potentially detrimental situations can arise. And with coaches, I think the big thing is just making sure that they understand where the final say in the healthcare of the patient lies, and then getting them to buy into that process and know that we don't make decisions to try and hinder the success of the team. It's more about the safety of each individual student athlete.
Good. I'm glad that you've been able to adapt some changes within your practice. Rufus, have you found yourself reflecting on your clinical practice since the simulated learning experience?
Yeah, I mean, I think that's something that I've kind of naturally done throughout my career, even prior to the simulated experience, but even more so after doing something as close to real life like a simulation and seeing what areas can be improved. You really see just how much room for improvement there can be, even outside of just like a situation like this, whether it be like the communication or the education aspects, or even in the moment of actually managing an emergent care situation, just making sure that every time we find something that we can improve upon to continue to get better and provide the best possible care to our patients.
Thank you. Can you describe any experiences where you were able to change your behaviors in other clinical scenarios following the simulated learning experience?
I think I think the biggest thing I would say was in other acute care situations, so outside of more of the heat illness or the environmental conditions. So whether it be like an orthopedic emergent situation or more of a different type of general medical or first aid type situation, just trying to be very reflective of my practice and making sure that I'm maintaining the highest standard of care throughout some of these situations that can be very important to the health and safety of a patient.
Were you able to actually change any behaviors that you've done? Have you noticed any actual changes?
Can we come back to that one?
Yeah,
Okay.
and if you don't, that's okay. It's just a kind of a question based on what you had said. That's actually all the very specific ones I have, but I can even add that question into the end. Do you have anything else that you want to add to the overall interview that I may have missed?
I think as far as like the simulations go, obviously it would probably come down to like the feasibility, like being a participant in the simulation. I don't obviously see all the intricacies of like planning the full thing and how much time it takes to put all that together, but I think especially like a little bit more of like the large scale or like a multi-clinician simulation like this, it would be really cool to be able to experience each of the different, I guess I'll call it each of the different like subsettings within it. So be the clinician who works with the rhabdomyolysis case, be the clinician who works with the patient who's experiencing a sickling crisis, be the clinician who works with the patients who kind of came in that just kind of had like the general like DOMs that just kind of left in the middle because they didn't feel like they were getting as much care as possible, be the one that works with some of the other heat illness conditions that were presented as well, which obviously that would mean performing the same simulation multiple times and kind of rotating through each part, but I think that would be really neat. And I don't know how feasible this part would be, but like the ability to do like a video like recording of the simulation, like to go back and look at during the debrief and highlight like certain things.
Okay.
I think that would be something that'd be really neat to see as well and help with reflective practice too.
Yeah, for sure, to be able to see what you did instead of just people saying it.
Yeah.
Perfect. Rufus, do you have anything else that you want to add?
Not that I can think of off the top of my head.
Okay. Well, thank you for your time during this interview. The information you have provided has been very helpful. Once the interview has been transcribed, I will send you a copy of the transcript via email. This will allow you to read over the conversation and check it for accuracy. During the time that you have it, you'll have the opportunity to provide any clarifications or updates to your initial responses that you gave to me today. Again, I appreciate your willingness to participate in this research study.
Thank you.
Thanks.